Patient selection should be purely on the physician, and it's based on when the patient shows up to the physician's office. And then hopefully that physician was clinically savvy enough and astute enough and awake or having the right amount of attention to identify the right patient for certain technologies. Now, I think this would be really interesting is that for MedTech companies to have some sort of AI software capacity where it says, hey, if we have a partnership with your EHR or whoever it might be, let's get access to that data so we can start identifying those patients.
The fear today in the system is that if we go out and just put devices on this broad population, I'm adding a whole ton of cost I don't need to add because I'm not very good at finding them. But if we are now able to produce AI capabilities that can target these populations with a yield of 90% or better, I think the appetite to begin to proactively search for these folks is much, much higher. So every one of these commercial pilots that we've launched with our innovative channel partners, they're looking at a patient profile and they're identifying criteria and saying, if you meet these criteria, we're going to go ahead and get a patch on. Now getting a patch, in fact, do have an actionable arrhythmia. That's changing the ballgame.